my name is Ainsley and I'm one of the exercise physiologists at Active Seniors. A question I get asked all the time is, what is an exercise physiologist? So I thought I'd go through a bit about how I explain it. If you'd like some more information, feel free to go to our governing body's website, and that's ESSA, which stands for Exercise Sports Science Australia. So feel free to visit them to get a bit more information. But when someone comes to me and they ask me, what do I do? What is an exercise physiologist? The best way I can phrase it is that we are university trained to use exercise as treatment for many different conditions. And sometimes we can even use exercise to help prevent conditions, which is amazing. I really believe that exercise is kind of the key thing everyone's been looking for, this magic drug that will, solve all these things, and it kind of is, but no one wants to take it. No one wants to do it because it's hard work. It's not quite as easy as taking a pill. So pretty much when I see someone, when they come into the center and I explain to them that we use exercise as treatment, we'll go through a series of things that'll help me form what program they'll have. And I need to make sure it's evidence-based. I can't just go on a whim, try this, try this, try this. I might trial and error, but I've got to have a reason why. Usually it's based on the physiology, or it's also based on lots of literature reviews that we've had to go over and get an understanding of why this works and why this might work for this condition, but not for another condition. So the first and most important thing is knowing someone's medical history. I need to know when you had that knee injury 4 years ago, but you're not really affected now, because it might still affect you in other ways. Your gait might be a bit affected, but you didn't realize it. You might get a bit of hip pain, and it might be related to that knee injury, but you didn't know. So it's really important. There's nothing too little to tell us when you come see us. The second thing is that I need to get your goals. It's pointless me seeing someone and they have, 3 different things going on, and they don't really want to work on anything that kind of focus on that. They really just want to work on something like, they really want their legs to get stronger, but they don't really have any leg injuries or anything like that. I still need to make sure I cater to that, because that's what's going to motivate you. That's what's going to keep you going and keep you wanting to see results. So that's really important as well. And I need to kind of combine what's good for you in terms of your medical history, as well as what you're kind of looking to get out of your exercise. And I combine them together and try and get something produced from that. The third and final thing is I do a series of tests. So we call it an assessment, and we might tailor some of the tests based on what your conditions are so that we can get a better look at them. And sometimes we might do some tests that you don't have any conditions related to them, but it's really important. An example is, I work only typically with seniors. I will do a balance test regardless. And I've had people have fabulous balance, and that's great. And I'll make sure that I try and maintain that. But, sometimes I see people who don't have any sort of history related to balance, no falls, nothing, and then their balance isn't that great. And so what I look at that is I go, okay, well, let's prevent something from happening, because I really don't like falls. We can do as much as we can to prevent falls, and that's something I'm very keen on. Once we see all this information, we'll gather it together, and then we'll teach someone exercise. Technique is something we're very focused on, because that's what is going to prevent the injuries, and as well as get the best outcome for what we're achieving. Okay, so if we're really trying to build muscle, we really want to focus on the technique, so we're not using too many other muscles to do the movement, or we're shutting off the muscle when it really should be working harder, things like that, and we keep going. Okay, if you're from another country, I can only really speak for Australia because I live, work and studied here. If you're from another country, please look at their own governing body, because it does change per country. I know that the UK is a little bit different from us, as well as the US is a little bit different from us. But here in Australia, we work mainly with chronic conditions. We work alongside allied health professionals. The key thing I always like to point out is we are not diagnostic. I cannot diagnose someone. That's not something I was trained to do. It's not something that I'm focused on doing. So typically what happens is, if someone tells me information and I think, oh, this is a bit suspicious, I'm not quite sure what's going on there, I will send them to their doctor, their physio, or whatever other allied health professional that they might see, and ask them to look into it. They might get a diagnosis, and then they'll come back to me and let me know, because that way I can give the best out of what I can do to them, because I'm not trained in that, and we're not trained to do that. We're not trained in what we call passive therapy, so I don't massage, we don't touch people. It's typically more to do just with exercise. That's our main thing, and that's what we mainly focus on. We do have to know a series of conditions, as I said before, so it's not just we specialize in one area. We might be extra interested in one area, but we certainly need to know everything. Reason being is typically, especially in the age group I typically work with, they'll have more than one thing normally. And I need to know how they work with each other, and I need to make sure I cater to both of them. I can't just ignore someone's osteoporosis, but I gotta flog them with aerobic or whatever it is. I wouldn't do that. But we've just got to make sure that we need to cater to every single condition, and we need to make sure that we're using best exercise, safest, most useful, most evidence-based, that will give them the outcome they need to make sure their condition is managed. That's something I always say, or we can help prevent conditions. So hopefully this was really helpful. Let me know in the comments below if you need to know any more information, or you're not really sure about what I said. We certainly can go into more detail about that. Have a great day, everyone. Bye.